consumers have a problem with health insurance?
Well, the first thing whenever I'm reading health insurance information is I hate doing this.
Insurance is getting trickier all the time, so.
I almost feel like they'd be looking for ways to not cover you.
To address these problems, the Affordable Care Act calls for a new health insurance disclosure by 2012. This new disclosure displays common information such as premium and deductible in a standardized way. Consumers are exposed to a lot of disclosures. So the major question here is, will this new disclosure help consumers? Let's see what consumers have to say. Consumers know what they want to see.
Cost in terms of how much it costs a year annually, and then what they offer.
How much is it going to cost me, and what am I going to get?
As clear as they are about cost, what happens when they read the typical summary?
Now this throws me off already because they talk about co-insurance, but they said the out-of-pocket limits were the same as the deductible back here, so I'm confused already.
I don't see how, if I'm missing something, it doesn't make sense to me.
I'm just keep seeing you must pay all costs up to the services of the amounts, but I don't know what that is. There's no examples, you know?
Just seems to me as if a lot of this on the front was just, almost hogwash for a better use of words, kind of.
Adding to their confusion, most consumers have a weak sense of actual medical cost.
I don't know, 50 to 75,000.
Probably 50, 60,000.
15 grand.
Part of the new disclosure attempts to address some of these concerns. For instance, the cost of having a baby is one of the examples in the new disclosure. Other information includes what the plan would pay and some treatment cost details, and what the patient's share is. How did consumers respond to the new disclosure?
I think a lot of people, it's easier to read, it's easier to get through, it's easier to get to the bottom line.
It gives more information in a concise manner.
This spells out, well, because this might happen, all that.
But consumer testing allows us to learn even more. It provides a nuanced understanding of how the examples help consumers. For instance, seeing treatment cost was startling, to say the least.
Wow, treating breast cancer, 98,000.
Chemotherapy, 64,000. Wow.
By seeing how much the plan paid of these costs, consumers saw the value of health insurance.
It just helps me understand it better that I'm not paying that whole thing, that the insurance is going to pay $92,000.
That $5,000, if something happens and you need surgery, I'm sure is chump change compared to not having the insurance.
A major concern in the development was that the examples would mislead consumers to think that the costs were a concrete promise, but in truth, consumers got it easily.
Okay, even though the change is not exact, it's still going to be close.
They don't want to say exactly how much something is because it could be way more or way less.
They're not saying, okay, this is set in stone, this is what the plan actually is. This is just an example.
In fact, testing showed that the number of disclaimers was overkill and off-putting.
The word might jumps out to me. Patients might pay. That's kind of like a sketchy word.
I don't like this word. Examples of plan coverage. How this plan might cover healthcare costs.
So what did we learn from the testing? The disclosure fills an important information gap about cost. The disclosure makes the benefits of the plan concrete. The disclosure makes it clearer why health coverage is valuable. Consumer testing let us test drive the summary to see what had worked and what needed fine-tuning. But most of all, it showed how consumers would use the summary to make sense of health insurance.
Thank you so much for showing that video. So I'm Lynn Quincy, and I'll provide a little context for what you just saw. I'm with Consumers Union, and a couple years ago, we did a whole bunch of consumer testing around this new health insurance disclosure that's required by the Affordable Care Act. And in the process, I think we learned a lot that has bearing on what you're discussing today. I did want to start with an apology. I was in California yesterday and took a red eye home, and the plane was late, and I did miss the first hour today. So if there are some linkages that I'm not drawing in connection with what I'm sure was a great presentation to start, please help me draw those. And I also think, and another apology, I sent my slides out, but something happened in the internet ether, and so I will be speaking without you being able to see the slides. But we can recover from this because one of the slides is something I was going to present on is going to be presented on later. So this is all going to work out. So we did a whole bunch of consumer testing. And here's the and I think this is really important. I think this is why Terry's presentation was so compelling. Hearing about actual people who are actually struggling with this information. I'm going to talk exclusively about trying to shop for health and plans and the numeracy issues that are involved there. And just so you know it, where the box around what I'm talking about. The bottom line is that people dread shopping for health insurance. And this is a barrier we would really like to overcome because we want people to be insured for all the reasons. I don't have to go into it. The big reason that they dread shopping for health insurance is that they don't understand the product, but they realize there's important health and financial implications for their families. So this is a very stressful thing for them because they know it's important, yet they can't figure out which plan is best for them. And it is the primary reason they can't figure out which plan is best for them is that they are confused by the cost-sharing terms. This is an enormous barrier for consumers, and there's a lot of numeracy components to this barrier. First of all, they don't know the vocabulary. What do these words mean? Deductible, out-of-pocket limit, annual benefit limit. Not only are these concepts complex, and I'm going to give you a very specific example of how hard they are, but then these complex concepts need to be used together. You need to understand things like, does the copay count towards the out-of-pocket limit? So you're taking not only these standalone concepts that are hard, but you really need to be able to weigh them and bring them together to get to a bottom line. And this is a task that's all but impossible for consumers at the point of health insurance shopping. I'm going to give you just one example where we dive down deep on why this is so hard. And the example I'm going to use is the cost-sharing term coinsurance. In testing, which is extremely valuable because you get nuanced information about what is a barrier, we learned there are actually 3 distinct things that are difficult about coinsurance. One is consumers are confused about who's paying the indicated percentage, particularly if they see a number like at the 2 extremes, like 0%, 10%, 90%, 100%. They're like, so do I pay that or does the plan pay that? And it can be clearly labeled, you pay 90%, and they're still like very uncertain about who's paying it. So that's point of confusion number 1. How do you calculate a percent? This, I don't know if this was discussed earlier today, this is very, very hard for a lot of consumers. We had one participant who could not tell us what 70% of $1,000 was. She said, oh, it's about half. No matter what percentage we gave her, she said, it's about half. She just had no idea how to apply a percentage. And then third, what does the percentage apply to? So even if you're good with your percentage as a numeric concept, what does it apply to? Well, it applies to something called the allowed amount. What is that dollar figure? That is an unknown. You can't actually get to a bottom line, even if you're really good with the first 2 things, who's paying it and how do you apply a percentage, because you don't know what the allowed amount is in most cases. You actually don't know what your obligation is in advance. So as a result, consumers approach health insurance testing. This is where I wish I had my slides. And it's like a whole bunch of Greek to them with some numbers that they can see in the middle of all this Greek. They simply have to throw a dart and guess. They do not know which is best for them. Now, we do, though, I think what we want to get to is not talk about how hard this is, but say, what can we do for consumers? How can we make this better? And fortunately, we've got a lot of indications about things that can be done. First of all, consumer testing is the way to go. That is the way we're going to get to the solutions, those icons, the colors, the pill shapes, everything we need to do. We're going to consumer test it, and that gives you the information on the path forward. The process I like to think about in terms of making it easier for consumers to overcome these barriers are to first improve the underlying product as far as you can. Second, improve the way the products are communicated. And then third, try to educate and activate consumers. But first, we should be trying to do the other things. So coming back to health insurance. The first thing we should try to do is simplify the actual product. And the Affordable Care Act does a lot of this. It is standardizing, for example, the out-of-pocket limit. And going forward, if you're shopping in the non-group or small group markets, the out-of-pocket limit can't be as holy as it is today with all these exceptions and that consumers have to watch out for. So while it's not perfect, there's a lot of things going on that help standardize the product, so there's fewer moving parts. So that's good. States like Massachusetts have gone even further, where if you're shopping in the non-group market in what's called the exchange, the benefit designs for a given tier of service are actually almost identical. And so the consumers don't have to compare within a tier, like I'll call it silver low. You don't have to compare co-pays and co-insurances and things, because it's all exactly the same, and only the premium and quality measures are different. So that starts to make it really easy for consumers. And again, that's a slide I wish I could show you. You would say, ooh, I wish I was shopping over there. But here's a whole nother area where we can help them. And I call these things cognitive shortcuts. You saw in the video that those consumers were looking at a specific aspect of our new health insurance disclosure called the coverage examples. And if you can remember, it showed, first of all, the price of an average price for that medical procedure, like having a baby, treating diabetes for a year, treating breast cancer. This was mind-blowing for consumers. It's a piece of information they're completely missing. So they love that. It also does the math for them. It says, here's what the plan pays, here's what you pay. It's like pulling back the curtain. And this information, this new way of displaying how the provisions of the health plan work was so powerful. We had people in testing who went from saying, I would never buy that plan, a $2,000 deductible, are you kidding me? That's not any kind of coverage. And then they saw the breast cancer example. And they saw that even though they had a $2,000 obligation, the plan was paying $98,000 on their behalf. And that's a piece of information that was completely missing as they were going about this simulated shopping exercise, because consumers actually forget about the insurance component of insurance. They think of it as prepaid health care often. So this, not only were we doing the math for them and overcoming some of these numeracy barriers, but we were reminding them of the value of insurance. So this new way of displaying information, it's already there embedded in 200-page policies, but it's not useful to consumers. By revealing it, it was very, very powerful. And I call that a cognitive shortcut, where we have basically given them the bottom line and said, here's why this is important. And there's lots of other examples of things that can be done just beyond the summary of coverage and benefits, or that coverage examples that you saw in the video. One that I don't have the slide, so I'll only talk briefly about this. If I had them, I'd be showing you the plan comparison that is associated with the checkbook tool, and Robert Krugoff is going to show that to you later. This also has some fabulous cognitive shortcuts where we've done the math for the consumers. It shows there's an estimate that says, for somebody like you, this is about what you would pay in out-of-pocket costs for the year. Under this health plan. So it's made an actuarial estimate of what you would pay, not only in premium, but also in out-of-pocket costs. It's not a promise of what you would pay, but it allows you to rank order plans. And suddenly you have put the consumer so much further ahead of the game in terms of shopping. And I'll let him talk more about all the different visual clues that kind of help consumers do more rank ordering of plans in a very reasonable way. So the bottom line for me is that if we can do this, we just have to do it. We have to pull together the research that says how you do it. We have to pull together the political will to say it's time to do it. It is time to allow consumers to shop with confidence for health insurance. And those are really the barriers. It's not a barrier. I do not think there's a meaningful barrier of figuring out how to do it. I think that can be done through a process of iterative consumer testing and bringing smart people to bear on the problem. And so I'll stop there and hope that this is what this workshop leads to.
Thank you.